I'm Franco Cappuccio, Professor of Cardiovascular Medicine and Epidemiology at the University of Warwick, and I'm also a consultant physician running a hypertension clinic in Coventry. I'd like to talk to you about one aspect that's very important in hypertension prevention and management, and that is the importance of salt and the way we manage the level of salt we eat. And salt is a major component of our daily diet and is an essential component of our nutrition. However, the amount of salt we need for our body to function properly is a fraction of the salt we currently eat in our daily diet, almost about 10 to 15, 20 times higher than we should eat. And that has been clearly shown to be one of the major determinants of high blood pressure in our populations, in our individuals, and also a reduction has been clearly shown to be of great benefit to individuals and populations in trying to manage their blood pressure and to reduce the use of medications if they have high blood pressure. Now, salt comes mainly in our diet historically from the need for refrigeration, salt in our diet enters through the history when we did not have refrigeration yet and we had to keep the food from rotting. But now, in a new era, the amount of salt that comes in our diet is due to different purposes and mainly is added by industry in the processing, manufacturing of food and could be avoided. Now, for those who don't know, about 3/4 of the salt we eat comes from salt added to our food by somebody else. Only 1/4 of the salt we eat is decided by us using the salt cellar or adding salt to cooking. So it's very important that we address the potential reduction in salt intake as a way of reducing blood pressure in two ways. One is by improving the awareness of people like you and me that salt is bad for you and should not use it in your cooking, as normal food will guarantee the amount of salt you need for the body to function. So no way of adding salt to food and cooking will be the first way to do it. If you're concerned about taste, the taste will adjust within 4 to 6 weeks and you will get used to having a lower salt content food and enjoy the food in different ways. But the most important thing is that would not be enough to reduce the salt we eat currently to a level which is safe. At the moment are set around 5 to 6 grams of salt per day, which at the moment is about at least half of what we eat currently. So how do we achieve that? The next level is really to try and avoid the very salty food present in the supermarket on the shelves, whilst there is an action at public health level to encourage the industry to reformulate the food with less salt in it. But what is left to you in terms of choice is to try to identify salt at a very early stage before you buy your food. Now, it's very difficult to do so because labeling is still quite complex. And I think organizations like CASH with the government and the MRC have developed, for instance, in Britain, a very helpful app that you can download freely called Food Switch, which exactly empowers patients like you to identify and understand the labeling of food at the point of purchase. In other words, you can download this app with a camera, you scan your barcode, and the app will tell you in a very simple and understandable way all the content in salt, fat, energy that item has to empower you to choose whether or not it's worth buying it. So from the point of view of doctors, again, it is very important that the question of how much salt your patient eats should be part of your routine approach. I'm very conscious that in 7 minutes in primary care it's very difficult to pack everything in, but a much greater dissemination of information within your practice will be the very, very first step to make patients aware and alerted about the importance of reducing salt in their diet. If you were to invest a bit more resources to assess individuals' salt intake in order to make a motivation to reduction with a way of monitoring their success, we would recommend carrying out a 24-hour urine collection whereby you can assess the individual salt intake by measuring the excretion of sodium in the last 24 hours. So by and large, I think this is to motivate people like you and me in terms of patients, doctors, to increase awareness and act to reduce the salt content and the salt consumption in patients as well as people as a first step to tackle the prevention and management of hypertension.